A random forest predicts which patients will respond to immunotherapy with 90% accuracy. Impressive. But which genes are driving the prediction? Is the model using known immune markers or hidden artifacts? Without interpretation, the model is a black box, useful but opaque. The X-ray lets you see inside. Model interpretation matters for 3 reasons. First, biological discovery. If the model uses unexpected genes to predict drug response, those genes are hypothesis-generating potential new targets or biomarkers. Second, trust. Clinicians won't use a model they can't understand. The field increasingly requires explainability for machine learning models used in clinical decision-making. Third, debugging. If the model achieves high accuracy by learning a batch effect or confounding variable, interpretation catches the problem. A model that predicts survival by learning which hospital the patient attended had learned nothing about biology. The jury video introduced permutation importance. Shuffle one feature, measure accuracy drop. This gives a single importance score per feature across all predictions. Impurity-based importance measures the total reduction in gene impurity from splits on each feature. Regression coefficients directly show feature importance for linear models. These are all global interpretations. They summarize average importance. But they don't answer, for this specific patient, why did the model predict non-response? Individual predictions need individual explanations. SHAP, Shapley additive explanations, borrows from cooperative game theory. Imagine the features are players in a team. Prediction is a team's score. Shapley values fairly distribute the score among players by computing each player's marginal contribution across all possible team combinations. For feature X, compute the prediction with X in every possible subset of features, and without X, average the differences. The SHAP value for X is its fair share of the prediction. For any single prediction, the sum of all SHAP values equals the prediction minus the baseline average. This additive property makes SHAP values interpretable and consistent. SHAP summary plot displays feature importance and direction for all predictions simultaneously. Each row is a feature. Each dot is one patient. The dot's position on the x-axis is the SHAP value, how much this feature pushed this patient's prediction up or down. The dot's color represents the feature's row value, red for high expression, blue for low. If gene X has red dots clustered on the right, high expression of gene X consistently pushes predictions up. If gene Y has blue dots on the right, low expression of Y pushes predictions up. The vertical ordering ranks features by overall importance. The SHAP dependence plot zooms in on one feature. X-axis, the feature's raw value. Y-axis, its SHAP value. The shape of this relationship reveals how the feature affects the prediction: linear, threshold, U-shaped, or saturating. Color the dots by a second feature to reveal interactions. If the dependence plot for age changes slope when colored by sex, steeper for males, flatter for females, there's an age by sex interaction. Dependence plots convert SHAP values into interpretable dose-response relationships between features and predictions. Feature importance ranks features globally. SHAP values explain each prediction individually. Summary plots show patterns across all predictions. Dependence plots reveal the shape of feature effects. Next, explaining one prediction at a time.